All right. So I got called out to a 911 hang up. Had a mother call me, tell me that her diabetic daughter, who is of age 9, has passed out. So that's pretty much what we're running with. That's all we got to start off. So we pull up to the scene safe. We got our gloves on to go to work. Nature of illness is going to be something around diabetes. We passed out. We're in syncope. Mechanism of injury, there really is none, but we're still going to check for that because since we went unconscious, we never know if they hit anything on the way down. The number of patients is 1, 9-year-old girl. Additional resources in case things get bad. I could need ALS in the tract of things. T-spine, not really going to consider it from the beginning, unless of course we like hit our head like really hard on the way down or injured our spine in any way in the fall. General impression is a 9-year-old on the couch, as shown. And there are no life threats currently. No anaphylaxis or squirting blood of any sort. So we go ahead and approach the patient and we talk to her. Nothing else. And we say, hey, it's Mello from Medic. What's going on today? I give her a shake. I give her a squeeze. And she does not react to anything. So we're unresponsive. So immediately off the bat, before I even go into the airway, I'm going to go right ahead and just check for a carotid pulse. I'm going to look to see if she has a pulse. And she has a pulse. And I'm looking for breathing as well. And we're still breathing. So I proceed to then look at the mouth. I'm going to do the airway check. I'm going to give her a small jaw thrust here. I'm going to take a light to it, check it real quick. Patent, clear, a little dry. See, I don't know. I'm going to go ahead and listen to her breathing to see where it's at and get an RRQ of it. Clear. 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 The rate rhythm quality is a little concerning because right now she's having really shallow breathing. It's kind of fast. The body's kind of compensating for, being in a faint state. I will give her oxygen at this time to help her breathe. Just give her some high flow. I'll put her on a non-rebreather at 15 liters per minute. And I can start it here because I brought the stretcher with me. That's normally what we do when we're riding ambulance. So I'll go ahead and start the oxygen here and try to get her in a better state. See if I can actually improve the level of consciousness. So I'll go ahead and start that and I go ahead and run into circulation. Let's go ahead and see where that's at. So I'm going to take a pulse from her. It's very weak, but it's fast. I look at her skin. She is a little diaphoretic. She's definitely cool to the touch, very moist, which is indicative, of course, of a hypoglycemic event. I'm going to give a quick little blood sweep, nothing too intensive, but I'm just going to make sure she didn't bust her head on the way down. I look and check to see if we have anything, just to make sure we didn't hurt ourselves. Diabetic patients do not heal the same as regular patients. Check the arms, so on and so forth. Sorry, my back is to the camera. It was the best angle I got. I do give her a squeeze here. Cat refill is right at about 3 seconds. She is pale. Again, another indicator of hypoglycemia and the like. So I am definitely going to, at this point, make her a priority patient due to the level of consciousness, which in a little moment for the scenario is going to hopefully improve so we can actually talk to her. Of course, we have mom on scene and we're going to ask questions. But she is definitely a priority patient at this time. We need to get her in the ambulance now, quick, and we need to bring mom to ask questions because our kid's unconscious unless our kid comes back and can answer some questions. Even then, it's still going to be really hard to talk to them. We're still going to be a little confused and dazed out of proportion. So I do quickly try to talk to mom and ask her what happened, what led to this moment, what medications is she on? Did she take insulin? Does she take any pills to bring her blood sugar down? Does she have an insulin port? Does she have any allergies to any medications that we may give her? What was she eating today? Has she eaten a normal meal today, which is really important for diabetic patients? Has she done any extraneous activity that is abnormal for her like routine life? And of course, I'm gonna go ahead and defer OPQRST for the moment because we're not in like pain, we're in a kind of shock. So for medications, we would get into the ambulance, and so we're not really gonna act this out, but we'd get into the ambulance and her level of consciousness would hopefully get better with the glucose, or excuse me, not the glucose, the oxygen that we're giving her. And we're getting her in the cool truck. Of course, we're gonna cover her with a blanket to not let her get too cold because we don't want her to get hypo. And then hopefully when we wake up, if she has a good gag reflex, she can talk to us and she shows a better improved level of consciousness, then I'll give her the tube of glucose to hopefully eat, which is 15 grams buccally. Then we'd, of course, reassess vitals every 5 minutes, which I went ahead and took on the ambulance. Her blood pressure was low. We were sitting at about 100/75, which is kind of low. And we were sitting at a quick pulse of about 100 beats per minute. We were looking at a blood glucose level, which is really important to take. The BGL was sitting at around 32, and it was super low. So that was the importance of getting, if not oral glucose in that moment in, at least some glucagon to slowly start getting the conversion of glucose to happen. That's about all we got on this one. Of course, her O2 I took, and it was sitting at 97 on room air. So she was breathing fine, just quick and trying to compensate for the hypoglycemia that she was experiencing. Her pupils were fine, they were pearl. And her respirations were quick. Again, they were sitting at like 26 respirations per minute, quick breathing like so. But of course, we're gonna get that all better and get her to the hospital because the main pitch that we give to the mom is if she remains in a loss of consciousness, if she remains in this state, that could lead to like brain damage and like serious, problems. So that's basically where we're sitting at with this one. And that's it. Thank you.